just a quick review of the MaxRank Knee Brace. So this brace is made specifically for people that are having some type of knee pain or having, some kind of knee problem. And the idea here is that you put on the brace and it supports the joint, it supports the soft tissues, the muscles around the joint, and it restricts your knee motion a little bit. So that way your knee has a chance to rest, recover, and it doesn't get so overstressed as you're doing things. So a few points about this particular brace. It will fit either the right or the left knee, which I think is a big plus, because let's say your right knee's hurting you and you put the brace on. After a while, your knee's doing better, and then maybe down the road your left knee hurts. Well, you can still use the same brace. You don't have to worry about buying another one. It is made of very breathable fabric. It's got these breathable holes, as you can see throughout the whole thing. And that's kind of a big deal because really, you wear this thing, you probably wear it when you're most active. A lot of people, when they play sports or something, or you're going to go out and do a lot of gardening or something, or if you wear it all the time, especially in the summer months, this thing can get kind of hot and warm. You sweat, of course. And then the brace starts to pick up, the sweat, and after a while it stinks, and you got to worry about washing it and all that kind of stuff. So it's best to start out with a highly breathable fabric first, which this is. The other thing, note, this has actually a patella, or your patella is your kneecap, gel pad. So this is actually like a gel pad that goes around your knee. So if you need a little extra stability around your kneecap, I think this is a good choice. So other things you can do for your knee besides a brace, I'm getting this from Bulletproof Your Knee. If you have any kind of a knee problem, make sure you're doing at least one exercise for your quadriceps muscle. Quadriceps muscle is the big stabilizing muscle of your knee. It's made up of 4 different muscles, and collectively it's called the quads or the quadriceps. So what the deal is researchers are finding that just about any knee problem you can name, if researchers go and they test all the muscles around your knee, they find there's just selectively the quadriceps muscle takes a big hit. In other words, it's not as strong as it should be. And some of these studies, they're doing CT scans and looking at cross-sectional area, finding it's actually a lot smaller than it should be. So for instance, knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So you have any kind of acute or chronic swelling in your knee, it takes its toll on your quadriceps muscle. Ligament problems in the quadriceps. Anterior cruciate ligament, also known as your ACL. You've heard of football players tearing their ACL. Look at this. One study looked at people who had ruptured their ACL. Researchers found that strength of their quadriceps muscle in the injured leg was decreased by 25 to 30%. So here again, you're taking a big muscle that stabilizes your knee and you're whacking its strength down 25%, over a quarter of the percent of its strength. It's going to be hard to get better or get back to normal and pain-free unless you get that strength back. Posterior cruciate ligament, same thing. Medial collateral ligament. Knee pain in the quadriceps. So they find that if you have pain in your knee, it actually decreases the strength of your quads. Probably some kind of reciprocal inhibition kind of thing. Knee arthritis in the quadriceps. If you Google knee arthritis and quadriceps, you're going to find it's very, very consistent that people with knee arthritis usually have quadriceps weakness. And there actually are a lot of randomized controlled trials out there showing that if you take a group of people with knee arthritis and you strengthen just their quadriceps muscle, that their knee pain starts to go away. And interestingly, some of these studies are showing that people with the strongest stronger quadriceps muscle have the least progression of knee arthritis. So if you have knee arthritis, you've got a lot of reasons to strengthen your quads. Patellofemoral pain syndrome, and the list goes on and on. So if you have any kind of knee problems, make sure you do at least one exercise for your quadriceps muscle. Fine-tune control over your knee. Here they're talking, I think, about the hip muscles. Sometimes you can have a really bad knee pain, and there's absolutely nothing wrong with your knee. Problem's up at the hip. So classic cases like iliotibial band syndrome. You take a bunch of people with iliotibial band syndrome, and what the researchers are finding that they have unusually weak hip abductors. And abductors keep your pelvis level every time you take a step. Also brings your leg out to the side. So here again, just like with knee arthritis, randomized controlled trials showing if you take a group of people with iliotibial band syndrome and you strengthen their hip abductors, guess what? Iliotibial band syndrome starts to go away. So optimize knee flexibility. Well, we all know we need a knee that bends and straightens sufficiently. A lot of people don't know is that your knee also rotates. So about the last 10 to 15 degrees of you straightening your leg, your knee actually rotates laterally. So here's a little test to see if you have that accessory motion. So that is an accessory motion. You really need to have a fully functioning knee. And you can stretch it out with certain stretches. Anyway, other things you can do. Last one up, increase dynamic knee stability. Here they're talking about proprioception. So if I suddenly turn the lights out, you'd probably be able to tell me whether your knee was bent or straight. That's because you have these receptors in the joint and the soft tissue and the muscles around your knee constantly give your brain feedback as to where your knee is in space. So that's how you know where it's at in the dark. So when researchers look at people with various knee problems, they find, hey, their proprioception isn't what it should be. Now, it's not that they can't, they don't know where their knee is. They're just not normal. They're just not up to a normal level. So that's also something you can do with exercises. So other things you can do if you need to. But hey, nothing's as quick as putting on a brace. A lot of people say they put on a brace and knee pain goes away pretty much right away. So it's a good brace. Check it out.